Correspondent Kieran Jenkins. Kieran.
John, Nicola Sturgeon ended her emergency statement here today with the words, "Stay at home, protect the NHS, save lives." Familiar words. It is like March all over again. So in Scotland, from midnight, you can only leave your home for a handful of reasons. Schools here will remain closed after the Christmas holidays until at least February, so it's online learning once more. What's different, as you've been hearing, is there are better treatments and there is a vaccine. But it's also freezing cold, and for many, on a number of fronts, then it will be a bitter start to 2021.
In Glasgow this morning, the weather provided its own incentives not to venture out. But from midnight, it becomes the law in Scotland to stay at home. The Scottish Parliament was recalled to hear the First Minister announce lockdown is back.
Our fundamental advice for everyone is to stay at home. That is the single best way of staying safe. We consider that this stay-at-home message and advice is now so important that from tomorrow it will become law, just as it was in the lockdown last year. This means it will only be permissible to leave home for an essential purpose.
Why such urgency? Well, the Scottish Government has been told that the new variant of the virus that's causing so much concern now accounts for almost 50% of all cases in Scotland. Nicola Sturgeon said that the position here was around 4 weeks behind London and the southeast of England. And so there was today an opportunity, she said, to act quickly, decisively, to stop the situation in Scotland deteriorating to that extent.
The current picture in Scotland isn't quite as bleak as elsewhere in the UK. While hospital admissions are higher than the spring peak, the numbers in ICU are not at those levels yet. But it's looking ominous. Remember, all of mainland Scotland is already under the toughest restrictions. So lockdown may not feel so different this time. Places of worship close from Friday. All schools and nurseries were shut anyway until January the 18th, but will now stay shut until February, except for vulnerable children and those of key workers. Outdoor exercise is among just a handful of exemptions to the stay-at-home law. But excluding children under 12, you can only meet one other person outside.
Up to two from two households.
Okay.
So one of you will have to take a pass.
That's a bit of a bummer.
We have to protect each other and stay safe, and it's the only way to move forward.
Schools will be closed until February the 1st, we're told.
You might ask them how they feel. They are really not very happy. They're going to miss their friends and the interaction.
When they told us we'd be off just for a week, I was fine, but I was hoping they wouldn't extend it. So it's not ideal, but I guess we'll just have to get through it.
Some public health experts say lockdowns across the UK this new year were not inevitable.
It didn't have to be this way, and everybody in public health would tell you that. I mean, the main things I would point to are the continuation of international travel, which still continues. Even though the quarantine is expected of people, we know from some data that is not complied with. Also, just in terms of testing and tracing, I don't think we've maybe been as proactive as we could have been.
Key powers on international travel are out of the Scottish Government's hands, but that does leave plenty of other levers. And while the vaccine offers a glimmer of brightness with the hope to get one dose at least into everyone over 50 by early May, just 4 days into 2021, it is lockdown and last resort territory already.
Well, now, earlier I spoke to Scotland's First Minister Nicola Sturgeon, and I began by asking her whether her decisions today were driven by the situation in Scotland or were they fitting in with tonight's announcement from Boris Johnson.
We've very much, in the Scottish Government, taken decisions today that we think are necessary in the face of a situation with the new variant of the virus that is as severe as any situation we faced since back in March last year.
Are you prepared to extend the lockdown, should that be necessary, at the end of January?
If that is necessary, we will do that. I hope it won't be necessary, but I can't say that with certainty right now. over the week from the 23rd to the 30th of December, we saw a 65% increase in our daily case rate. Now, our cases are still quite a bit lower than in London and the South East, but we look at the situation there and see that lying ahead for us if we don't act now to get it under control. And if we don't get it under control again, then more people will die than have to die. So these decisions are not easy. I don't expect them to be popular. Nobody wants to be living under a lockdown, but the duty of governments right now is to act quickly and decisively to try to save lives and protect the National Health Service.
Now, as you stressed, the schools are having to close too, so that people will have to be, children will have to be studying online. Are you going to vaccinate teachers as a priority?
Well, this is an issue that we are going to think very carefully about and do that as quickly as possible. The Joint Committee on Vaccination and Immunisation have given us, all 4 governments across the UK, a priority list. And on that priority list are people who are most at clinical risk of becoming ill and dying if they get this virus. So there's almost an ethical duty, in my view, to make sure that as we get supplies of this vaccine, then we vaccinate those people first. Now, many teachers will be in those groups because those groups include everybody over the age of 50 and people under 50 with underlying health conditions. That will include some teachers. But we want to look at, without compromising that clinical prioritisation, which would be wrong to do, how we do accelerate the vaccination of the whole body of staff who work in our schools and early years establishments.
Are you getting your fair share of the vaccine? I mean, how is this being done?
It's a population share, so we choose to procure the vaccine on a 4 nations basis. That's the most efficient and effective way of doing that, and the stocks are allocated on a population share. For Scotland, that's about 8.2% of the total number of doses that are procured UK-wide. So between now and the end of January, our assessment is that we will have at least 900,000 doses of the vaccine in Scotland. Now, that includes the more than 100,000 that have already been administered. Some of that will come quite late in January. Obviously, we hope that that will increase, but we're having to plan based on what we can rely on right now. Beyond the end of January, there's still some uncertainty in the supply schedules, but we hope that will firm up and become clearer in the days ahead. We must, all of us, we must administer this vaccination programme as quickly as possible. This is a race right now. In one lane, we've got the vaccines, we've got to make them run as fast as possible. But in the other lane, we've got a virus that has learned to run faster. So we have to slow it down while that vaccination programme gets ahead so that it can ultimately win the race.
You talked about having the over 50s vaccinated by early May. Now, that's 5 long months away. And people, I guess, had hoped that we'd be further along the line than that. And it indicates that perhaps the entire COVID crisis is going to last well into the high summer.
What I set out today is our cautious planning assumption based on what we do know about supplies and the recent change in the advice from chief medical officers and the JCVI about the dosing schedule, the 12 weeks between doses as opposed to 3 weeks. Now, that allows us to make a fairly confident prediction right now that by early May we will have vaccinated, at least for the first dose, all of that initial JCVI priority group. That's everybody over 50 and people under 50 with health conditions. That's in Scotland about 2.7 million people. And then we move on to the rest of the population. Now, I very much hope that we will be able to bring that timescale forward as we get clearer assurances about the supplies that we've got. And I've tasked our vaccination team here to explore every option available to get that done as quickly as possible. There's been 2 game changers in recent weeks. The positive one, which is the vaccines, and this horrible blow, which is this strain of the virus that is 70% more transmissible, and that's knocked us all for 6 and is driving this rapid increases in cases that we have. So we've got to speed up vaccination, but as we're doing that, we must slow down the spread of this virus if we are not to see more people than would otherwise be the case dying, becoming ill, and if we are to avoid our National Health Service being overwhelmed. These are difficult decisions, but they're unavoidable, and delay and prevarication just makes matters worse.
First Minister Nicola Sturgeon, thank you very much indeed for talking to us.
Thank you.